Obesity is not a lack of willpower. It's a multifactorial chronic condition that has environmental and individual factors. It's classified in people that have a BMI of 30 and above. And the main cause of it is moving less, eating loads, and drinking too much. The average calorie intake for a man is 2,500 calories a day, and the average calorie intake for a woman is 2,000. Now, I know that sounds like a lot, but it's not, especially when you consider that a lot of today's foods are ultra-processed sugary foods. So your average pizza takeaway is well above that. So the main treatment for an obese individual is a calorie-reduced diet and increasing exercise or activity levels. But what does that mean for physios? So often we think that it's just overloading the joints, and that's the reason why it has a big impact on the person's or individual's MSK health. And it does increase the mechanical load on joints because of the amount of increased adipose tissue. But there's also systemic effects on the whole body, especially within organs and tissues. It has an impact on osteoarthritis, rheumatoid arthritis, fibromyalgia, osteoporosis, back pain, and it also has pathways that link obesity to the MSK system, such as the ones that I've just described. So adipose tissues or cells have pro-inflammation cells known as cytokines, TNF-alpha and interleukin-6. So they contribute to systemic chronic low-grade inflammation that's linked to other chronic conditions. Obesity also impacts bone health. The adipose tissue regulates the levels of specific cytokines called adiposines, like leptin and adiponectin. These can lead to imbalances in bone metabolism and impact your MSK health. It also leads to decreased levels of activity, hormonal imbalances, and a reduction in vitamin D, which increases osteoporosis, frailty fractures, and your MSK disorders. So it also impacts your metabolic changes as well. So there's dysfunctions like insulin resistance and alterations in glucose metabolism, which lead to impacts on your bone health and to the joints. Not just that, these issues can also be exacerbated by the aging process. So that can aggravate or increase the risk of geriatric syndromes such as frailty and sarcopenia. So often the exercises that are prescribed for people with obesity are focused on losing weight. But that can be so frustrating for the individual and can actually be counterproductive. So the approach for physio should be different. We should be looking to reinforce MSK health, including bone and muscle mass, with anaerobic exercises. So resistive exercise can help to reduce fat mass and increase lean muscle mass and rebalance metabolic changes that are exacerbated by an excess of body fat. So that will help with elevating the metabolic rate. So your post-exercise caloric expenditure exercise will increase post-exercise oxygen consumption, and that will result in additional caloric expenditure. It will increase fat oxidation, so that induces a shift in utilizing fat for energy and will improve insulin sensitivity and glucose metabolism. Oh, I struggle with that word. Metabolism. It also has an impact on appetite regulation by influencing ghrelin and leptin and the person's mental health. So by moving, we know that exercise helps release happy hormones, and we know that it has an impact on anxiety and depression and low mood, just through moving. So if that person is struggling with mental health, it will start to have a better impact on that. The exercise will have impacts on anti-inflammation. So interleukin 10 is a brain-derived neurotrophic factor, and that produces agonists to the pro-inflammation cells. The exercise will also have an improved muscle performance, so they'll have a bigger functional capacity, and it will help with healthy aging as well. So it'll counteract things like sarcopenia, osteopenia, and frailty fractures. And it's also about educating the person that's living with obesity about things that they can do to increase their physical activity. So even things like your NEAT exercises or your NEAT activity, so your non-exercise thermogenesis activity. So that's things like, so that's energy that's expended for everything that you do that's not sleeping, eating, or sports. This guy's big on it. So that's things like walking to work, typing, fidgeting, cleaning, gardening. And that can have a big impact on energy expenditure. And it's not high impact on the joints either. So there you go. Obesity isn't just a lack of willpower. There's lots more that go through it, and there's things that physios can do that isn't just aimed at exercises for strength. So if it helped you, please follow me. Like, share and comment, please. And thanks for following the Pit Stop Box with me, Chris.